Good morning, everyone. Dr. The Honorable Sonia Brown, Minister of Health and Wellness. The Honorable Kay McConney, Minister of Education, Technical and Vocational Training. Deputy Permanent Secretary Acting, Ms. Gillian Applewaite. Permanent Secretary, Ms. Betty Allen Headley, Ministry of Education, Technological and Vocational Training. Chief Medical Officer, the Most Honorable Kenneth George, Ministry of Health and Wellness. Chief Education Officer, Dr. Ramona Archer Bradshaw, Ministry of Education, Technical and Vocational Training. Senior Medical Officer, Dr. Arthur Phillips. Mrs. Glensil Taylor, Acting Nutrition Officer, National Nutrition Center. Mr. Joel Emptage Cave, student, Harrison College. Valued partners, students, media, ladies and gentlemen, welcome to the launch of the Barbados School Nutrition Policy. My name is Marianne Burnham. I'm a nutrition officer and I am your MC for the morning. At this time, I will invite Mrs. Glensil Taylor to bless today's events.
Can we stand as we bow our heads for prayer? Almighty God, from whom all blessings flow, today we pause to reverence you in prayer as we officially launch the Barbados School Nutrition Policy. We seek your forgiveness for those times we have not lived in accordance with your purpose. We thank you for bringing us thus far in this journey, from conceptualization through the various stakeholder consultations, preparation, approval, and even our launch today. We ask you, God, that you would bless these proceedings and the follow-up efforts towards implementation of the policy recommendations. In addition, we request your blessing for every educational institution involved, that they will not only have the support of the stakeholders today, but that the implementation of this policy will be undertaken with the full support of our Barbadian society. As we endeavor to create healthy food environments within our schools, to promote good health among our children and all served in the school environment, we acknowledge that our human efforts are necessary, but are not sufficient. It is with this understanding that we commit these proceedings once more into your hands and every initiative that will follow, that ultimately the children and our nation will benefit from good health, as well as future generations. By faith, we believe that our request is in accordance with your purpose and offer thanks to you for these blessings in advance. In Jesus' name we pray. Amen. Seated.
Thank you, Ms. Taylor. Welcome again to the launch of the Barbados School Nutrition Policy Program. And the policy is a comprehensive framework to improve the school food environment, the foods we serve at school, the curriculum, and the school environment in and around the school. We want to thank our partners who work diligently in bringing this policy to fruition, which partners who include the Ministry of Health, the Ministry of Education, PAHO, the Heart and Stroke Foundation, the Healthy Caribbean Coalition, the School Meals Department, the University of the West Indies, the PTAs, and the Child Care Board, and others. At this time, I'd like to invite Mrs. Hedda Phillips-Boyce, Chair of the Barbados School Nutrition Policy, to give the welcome and share more information with you on the program. Hedda.
Dr. the Honorable Sonia Brown, Minister of Health and Wellness. The Honorable Kay McConney, Ministry of Education, Technological and Vocational Training. Distinguished guests and valued partners. Students, good morning. Good morning. Now, the pleasure is mine. And when I say a pleasure, I mean an absolute pleasure to welcome you to the Barbados School Nutrition Policy media launch. On behalf of the Ministry of Education, Technological and Vocational Training, and the Ministry of Health and Wellness, this event is of great importance because we are launching an initiative regarding our children's physical and mental well-being. Now, international research reveals that eating habits that children adopt in their formative and teenage years are taken into adult life. So the importance of prevention of problematic food habits is a priority, hence the genesis of the Barbados School Nutrition Policy. This policy will be used as a guide to inform what actions to take to alleviate the growing problems of childhood obesity. Now, I have to share with you how we got to this stage. Arriving at this stage was not easy. There were many ebbs and flows, pushes and pulls, mountains and valleys, and challenging hurdles to leap. When I was informed by my senior that I was responsible for the healthy programs in schools, that was part of my portfolio, I mentally clicked my heels. You see, I was always interested in how food affects the human body. So naturally, I was excited about the initiative. I thought that within 6 months to a year, that we would have programs in schools that would inform students' dietary habits. Was I wrong? So with my naive self, I was quite disappointed that we did not have the program instituted within a year. There were several meetings between the Ministry of Health and Ministry of Science, Technology, and Innovation, that was the name at the time. Meetings with the National Communicable Disease Commission, many conferences, a few high-level meetings. There were many frustrating moments. Fast forward to 2000. The Ministry of Health and Wellness commissioned the Pan American Health Organization to provide technical and administrative support for the development of the Barbados School Nutrition Policy. There were 3 consultative virtual sessions during the COVID-19 pandemic. Key stakeholders, including students, were engaged to ascertain their concerns and to gather their suggestions on areas to be addressed to develop this school nutrition policy. So my naive thoughts of 6 months to a year translated into 8 years. 8 years. However, we have a comprehensive document that will be implemented using a phased approach. Additionally, we should all learn that persistence and perseverance assist in achieving goals. At this point, I would like to acknowledge representatives who have been working tirelessly to wrestle this NCD beast to the ground. The Ministry of Health and Wellness, including the National Nutrition Center, PAHO, UNICEF, the Heart and Stroke Foundation of Barbados, the Barbados Childhood Obesity Prevention Coalition, the Diabetes and Hypertensive Association, the Healthy Caribbean Coalition, University of the West Indies, the School Meals Department, canteen concessionaires and vendors, Dietitians of Barbados, through the Queen Elizabeth Hospital, physical education organizations, and the Child Care Board. Let us create a synergy so that we are stronger together than we are apart. Present today are fellow colleagues in education, including representatives of the union and principals, representative from the National Parent Teachers Association, and our major stakeholders, our students. I would also like to acknowledge my colleagues from the Barbados School Nutrition Policy Committee, who have been tasked to be the champions for this cause. In some way, all of you have contributed by sharing positive messages to this initiative, whether it was public service announcements, webinars, lectures, discussions, research, competitions, preparation of healthy dishes, or encouraging healthy habits. The Ministry of Health and Wellness and Ministry of Education, Technological and Vocational Training appreciate you. We value your contributions and look forward to us working together to make an impact on the dietary and physical activity environment. Once again, I welcome you to the Barbados School Nutrition launch. Master Ceremony.
Thank you very much, Mrs. Heather Phillips-Boyce, Chair of the Barbados School Nutrition Policy Program. Mrs. Heather Phillips-Boyce reminded us that our activities, our behaviors in our formative and teenage years carry straight through to adulthood. So it's critical that we make the changes now to positively affect the future. We are aware of Barbados's high rate of chronic non-communicable diseases, and we have to find a way to tackle that. So we are starting with the children so that as they grow into teens and adulthood, they will take positive health behaviors with them, prolonging their life and their quality of life. At this time, we are going to have a presentation of the Heart and Stroke Foundation's monitoring app by Mrs. Francine Charles, who is a program manager at the Heart and Stroke Foundation. The Heart and Stroke Foundation is an entity that helps people who had heart attacks, stroke, people who have had cardiovascular disease. But what I commend them for is their focus on prevention. So yes, they treat people after they've had the health event and, people come to them, but they're focusing a lot on prevention with the childhood obesity program, the other child health and adult health programs, helping to focus on prevention, helping to focus on weight loss, exercise, and in general healthy living. So I commend them for that. So please welcome Ms. Francine Charles, who's going to present the Heart and Stroke Foundation's monitoring app.
Madam of Ceremonies, the Honorable Kay McConney, Minister of Education, Technological and Vocational Training, the Honorable Sonia Brown, Minister of State in the Ministry of Health and Wellness, distinguished guests, including members of the media, good morning. On behalf of the Heart and Stroke Foundation of Barbados and the Childhood Obesity Prevention Coalition, I am extremely pleased to congratulate the Ministry of Education and the Ministry of Health and Wellness for this launch of the School Nutrition Policy. As civil society, we commend this brave move towards securing our nation's future. And we look forward to supporting the rollout of this policy. As a signal of our support, we are pleased this morning to gift the Ministry of Education with two critical tools. Firstly, the alternative snacks and beverage list, which was put together by nutritionists and medical practitioners, members of the coalition, to help parents and canteen concessionaires to know what may be better options as they navigate the school nutrition policy. The second tool is our monitoring app. We are pleased to say that we were able to commission a local app developer to create this app to help with the initial phases of monitoring and evaluation at schools. Because as we know, this is going to be a critical component to ensuring compliance and support for the school nutrition policy. So what are the app's features? It's going to be a simple survey, very easy on your phone, very quick to complete. It's secure. Information on the users who are involved will not be captured. However, only very specific persons authorized by the Ministry of Education will be allowed to use the app. You will be able to take a photo, but this again will only be done by very, very specific people and a small number of people authorized by the Ministry of Education. The photos will be aimed at capturing products that are either not in compliance with the school policy, or also those that are now good and effective products that we can share with other schools. And then, of course, we'll be able to not only view results, but to actually capture the data and produce reports on a monthly basis. Who will use the app? The Ministry of Education and their partners. They will decide who those partners are as we move into the implementation phase. The school staff, we imagine that principals and very specific teachers may be asked to be involved in the monitoring process. And of course, approved school monitors. What is going to be monitored? The type of event. Food and drinks, what's being sold and what's being shared within the school compounds. Vending, what's being sold in the vending machines as well, we're going to be monitoring. And of course, physical activity, observing some of the best practices that are coming out of the program outside of the actual mandatory PE classes. Privacy, again, we explained that, first of all, we have really tried to adhere with this app with the Local Data Protection Act. However, we are still working with lawyers and with the app developers to ensure that all of the research, all of the approvals that we need will be in place, and all the legalities and agreements with the ministry are in place to ensure that this process is secure and that our children are protected. So how are we going to capture it? The event info. Each monitor is given a role. So we'll decide whether an individual from the Ministry of Education, an individual from the Ministry of Health, will members of civil society be involved in monitoring. That's the work that will now begin. The time of day will be recorded. So we will know exactly what times we are seeing certain types of activity. And each survey is time-stamped, so that it's not dependent on the user of the app to tell us when this was done. We actually will be able to capture that. And so what will happen? There will be a series of questions asking about what's being sold in the schools, what food items are available, what drinks are available, and you fill out any additional questions. And then we're also going to monitor the physical activity. We're going to assess the school environment for amenities such as, is there a playing field? Is there a school garden? Is there a gym? And then record what other physical activities students are engaging in, such as playing games or dancing or sports. And it's very important to take note that the app will not just be used to measure breaches and to capture individuals that are not doing the right thing. We are also interested in capturing best practices. And so we will be using the app to capture certain activities that we are seeing, certain products that are being sold. And the Ministry of Education will then be able to take those best practices from one school and share across schools. So I think we have a great start in terms of monitoring the process. Of course, we know there will be a larger evaluation process in place. And we wish everyone involved in this process the very, very best. Let's do this for our children. Thank you.
Thank you, Ms. Francine Charles of the Heart and Stroke Foundation. It is appropriate that we use technology to support what we are doing. So that app will monitor the food being served at activities, if there's any physical activity involved, and will help to capture some of the best practices so that we can apply them going forward. So congratulations to the Heart and Stroke Foundation on the creation of that app, and we look forward to using it. Now, this whole program is for the students, whether at primary, secondary, or tertiary level. This program is for the students to improve their future and to improve our future. At this time, I welcome Mr. Joel MTH Cave, where we would hear from him, a student's voice. Please welcome Mr. Joel MTH Cave, a student's voice.
Dr. the Honorable Sonia Brown, the Honorable Kay McConney, distinguished guests, good morning. My name is Joel MTH Cave, and I attend Harrison College for sixth form. Schools are a key environment for the development and education of our children in society. In essence, schools should be a positive influence for our youth and provide guidance they need outside of the home. With that being said, I have two questions. Should schools allow our youth to smoke? Should they allow them to drink alcoholic beverages? I think we can all agree that the answer to both of those questions is no. Smoking, vaping, and drinking are banned in schools for one reason: the health of our children. So why are other unhealthy practices allowed and promoted in these institutions? Everyone in this room has heard of the consequences junk food has on people and especially on children. Everyone knows that these foods are unhealthy, so why do we give our children an option? Look, we're children. Yes, we know that they're unhealthy, but at the end of the day, what do you think we will choose? Water or the red-dyed, sugar-sweetened beverage? Do we really have a choice when these products that are designed to be attractive to us are shoved in our faces, especially in schools? I think not. For example, last week one day, after class, I bought a sour candy spray from the canteen. I know the effects these foods have and try my hardest to eat to make healthy decisions, but realistically, I am still young and cannot be expected to have the same self-control as an adult. We cannot be left to fend for ourselves and make healthy dietary decisions. Hence why the responsibility of creating a healthy school environment lies predominantly on the policymakers and adults in charge. Adults make the decisions on what is and is not available for our children to consume. Availability is what it all boils down to. If the sugary snack that I knew very well wasn't good for me was not available, then I would not have had the chance to consume it. Removing these products guides us as kids into making healthier decisions, and while we may moan and groan for a bit, in the long run, as the data shows, it is in our best interest. Attention needs to be taken off of profits and put more into the health of our children. This policy is a massive step in the right direction. Removing the choice removes the consequences. I want to express gratitude on behalf of the student body to the Ministry of Education and to the Ministry of Health, not only for the implementation of this policy, but also for the continued open-mindedness to our views, ideas, and wants. Including the voice of the youth in topics like these is of utmost importance, as we are the primary benefactors. To the Honorable Kay McConney, thank you. To the Most Honorable Dr. Sonia Bradshaw, we as students thank you. This is just the beginning to creating a healthier school environment for our future leaders. I thank you.
Thank you very much, Mr. Joel MTH Cave, for your perspective. Yes, children can't expect to have the same sort of self-control as an adult. He made a very, very good point. But another point he made is that availability is key. If it's not there, they cannot buy it. If it's not there, they cannot access it, at least when they're within school grounds, within school hours. So it is in our interests to pay attention to that and to make sure that we provide the best foods when the child is at school so that they will make better choices. If they have choices, make sure that the choices are relatively good choices for them to choose from. All right. At this time, we welcome Minister Kay McConney, who is the Minister of Education, Technical and Vocational Training, to give her remarks. Welcome, Mrs. McConney. Ms. McConney.
Good morning, all. And the child shall lead them. Thank you, Master Emptage Cave. And Dr. the Honorable Sonia Brown, Chief Medical Officer, Chief Education Officer, Permanent Secretaries, Deputy Chiefs, and to all of you, our special guests, permit me to observe the protocol that has already been established. And in so doing, thank you all for being here this morning. It feels to me not just like the launch of a policy, but as the launch of a movement towards reordering the priorities in this country as it comes to activity, and healthy eating in our schools. Indeed, our health is our wealth. That is not my quote, but it is a quote from someone obviously much wiser than I am. And I want to say that this is true at the individual level as it is at the country's national level. Research has shown us, and we know this, that we are utilizing a significant amount of our national financial resources financing illnesses that are preventable. And the truth is, if we are using our monies for that, then we're not able to take care of the other activities that are necessary to our own sustainability and our existence as human beings and as a country. And I want to say that I am happy that my government has in fact seen the wisdom in making this a priority and has indeed made Dr. the Honorable Sonia Brown, the minister in the Ministry of Health and Wellness, with specific responsibility for non-communicable disease. If ever there is a reordering of priorities, that in itself is a statement of the priority that this government has placed on the eradication of NCDs in Barbados. Cardiovascular diseases are among the leading causes of death in Barbados, and diabetes and hypertension are among the most common diseases diagnosed in our primary care. This situation is not yet getting better at a rate that we would like and that we need as a country. And this state of affairs paints a grim picture for the future of our lives and of our livelihoods in Barbados unless we take action now. Teaching our children the importance of maintaining good health in their formative years is imperative. International research reveals that there is a significant relationship between health and academic achievement, and my government deems it important to create healthy school environments so that our children can reach their full potential. We here are all partners in this effort. And I am pleased to say that the Barbados School Nutrition Policy being launched today, it will be used as a guide for planning and creating strategies for improving the school environment. The overarching objective of this policy is to create a healthy school environment that enhances student learning and is conducive to the development of healthy, lifelong eating and behaviors through an integrated approach that engages multiple sectors. And when we say multiple sectors, we talk about government and the private sector and the non-governmental and non-profit areas along with society in general. And this all-encompassing approach, it is evident in the partnership among our ministries, the entities, and some of the organizations that have already been recognized here today. And I want to pause here for a moment, because I think if the Ministry of Education could ever have wanted a better partner, we could not have chosen a better partner than the Ministry of Health and Wellness. And I want to say thank you to the Chief Medical Officer, and thank you to the Chief Education Officer, Dr. Ramona Archer-Bradshaw. Together, they have been working and pushing this from behind the scenes as they enable the officers to do the work that has to be done. And if I start to call partners, some may feel that some are recognized more than others. There are those who have been pushing us, who have been calling, who have been making my WhatsApp go. And that would be those from the Heart and Stroke Foundation. It would also be those from the Barbados Coalition, Childhood Obesity Prevention Coalition, and others who I cannot tell you that Dr. Ann St. John and the members of the coalition have not reached out to me at least once in the last couple of weeks, nearly every week for Dr. St. John. And for others, I want to say to you, keep on pushing. A survey that was commissioned by the Heart and Stroke Foundation in 2018 and conducted by the Caribbean Development Research Services, it revealed that the public of Barbados is also interested in ensuring that our students are educated in an environment where nutrition is safe for them and healthy. According to the survey, 97% indicated that it is important for children to have access to healthy food and drinks at school. And a large number shared that the current school food environment is not healthy. 99% of those surveyed thought that it was the government's role to assist in reducing obesity and non-communicable diseases. Additionally, 92% supported having a national school nutrition policy to ensure that students are in a healthy school environment. Now, these statistics of public support for active and healthier nutritional environments in school, these statistics are impressive. But the truth is they only matter if we turn their support into action. And this government and our ministry responsible for education, we acknowledge the role that we must play in turning policy into action by enabling meaningful, fun-filled activities to educate our children about healthy living, while of course bringing along the entire schools community, our parents, our principals, our teachers, our concessionaires, our vendors, our school meals department, and all staff that are part of our school campuses. Based on the Barbados School Nutrition Policy, our action plan has been formulated to be implemented in Term 3, but as you know, many schools have already started and given us a head start. There are a number of schools in Barbados that have already banned sweetened drinks in their schools. There are already concessionaires and vendors who have started to remove from their offerings those snacks that are considered less healthy. And I want to pause for a minute again to acknowledge the engagement which was led by our Chief Education Officer, Dr. Ramona Archer-Bradshaw, last Saturday just gone, with vendors and concessionaires, where we had an outstanding turnout. And where that group of persons who are such an important part of our school communities, where the children, when they come to school on morning, they turn to buy little snacks or little breakfast, where at lunchtime they will buy a little something, and in the afternoon when they're leaving to go home, They will also go to the concessionaires and also to the vendors for their food. It was important that we carry them along with us on this journey. And I was told that the engagement on Saturday was unbelievable. There was a meeting after the meeting in the yard outside with concessionaires as they started to share with each other some strategies that had worked for them in encouraging the students to eat more vegetables or more fruits, where they were sharing little recipes as to how they are able to make foods a little bit more interesting so that the healthier options become the first option. And so I want to say to you that when we speak about this policy, it is not just about us having a piece of paper that says there is a policy, but we have started the movement hand in hand with the entire community that is part of our school campuses. Congratulations to you. The Chief Education Officer is telling me also that the concessionaires and vendors are seeking to put together a community of support for each other, to help each other at this time in the transition, recognizing that many of them have been vending on our school premises for 20-something, 30-something years. And we want them to continue to have a livelihood, but we want them to continue to do so in a way that is beneficial to our students and to our countries. We are all in this together, and we can all benefit if we do it right and do it well together. Now, I want to share with you, and just give me a moment, to share with you some of the specific actions that are being taken. As I said, this is not just a policy for policy's sake. It has actions behind it. Some of the actions that we are seeking to have implemented in a phased approach, among others. And we say a phased approach because we know you can't just get up tomorrow morning and stop a habit. In fact, people don't break habits. What they do is they replace it by another. And we want to give the opportunity for us to provide a healthy alternative so that when they leave the bad alternative or the unhealthy alternative, that they're able to step into something a little more healthy and reduce the likelihood that they will flip back. And so a phased approach is being taken with the intention that we will able together to transition the entire process within another year or two within our system. So some of the specific activities to which I referred. All beverages sold in schools must be unsweetened. And we have many alternatives out there. We have plain water, whether it's still or sparkling. We have water infused with natural fruits and vegetables. We have 100% fruit juices. We have 100% vegetable juice. We have all kinds of options that we have already started to share with our concessionaires and our vendors so that they don't just have to go and fight this and figure it out on their own, but we are working through it together. There are designated days as we start this phase process where we are asking schools to ensure on Tuesdays and Thursdays that healthy dishes must be served in your environments. The intention is eventually it'll be every day, but as we phase this in, let us make it mandatory on those days. Vegetables must be served with all meals. Healthy snacks, as recommended by the National Nutrition Center and the Heart and Stroke Foundation Barbados, will be sold on campuses. As you had heard earlier, there was research done where we had people, where the Heart and Stroke Foundation and the coalition, I believe it is, for the prevention of childhood obesity, that they worked together to go through the supermarkets and look at what are some of the healthier alternatives, and they have put the list together. And they are sharing that with the concessionaires and the vendors so that, again, they do not have to figure it out. We have done some of the work for them, and we expect that that kind of research will be ongoing, and therefore the list of healthier snacks that are being provided, those lists, we expect that the concessionaires will be using them to help them make this transition easier. Water Wednesdays will continue with 2 other days in the week added as we go forward. Fruit Fridays will continue with as well. Students will be allowed to drink water during their class periods, throughout the day, during class, as long as it is water. They will be allowed to do so. Primary school personnel and clubs at secondary schools, we are asking you, when you're doing your fundraisers, please use the same healthier list and sell healthier options when you are doing your fundraisers. Meetings should be conducted with parents, and we will be starting much more of that work, encouraging them to support the changes, because it's great to do one thing in the schools, but then when the children go home, it is another story. And the truth is, we understand. Some people are doing the best they can with what they have. But if we also make the students champions for healthier living, when they go home, they're able to make better choices, and they're able to say no and choose an option that is better for them, and even educate their parents. Canteen concessionaires, we will continue to provide workshops to sensitize you about the school nutrition policy, but also about healthier options and how you can use certain approaches to encourage the children to actually eat the vegetables. You know, we were in a meeting in our ministry a couple of weeks ago, and there was a teacher that was sharing how she had been able to get students who would look at vegetables and not be very attracted to them, how she was able to use certain techniques to encourage them to eat more. And the truth is, sometimes it just takes us trying a little bit harder and using a different approach indeed to encourage. There is so much more that are part of the activities. You heard about the Heart and Stroke Foundation's monitoring app, which, once it is approved for compliance and use within our schools, will be able to move to that level. We are asking our teachers to integrate across whatever subject they are teaching, to integrate healthy lifestyles and the nutrition. So in art, it is okay for you to have them draw pictures of what a healthy meal might look like for lunch. In science, it is okay to have them look at combinations of foods that are healthier. It is okay for us to integrate across the entire curriculum all of those things that will contribute to a healthier lifestyle in nutrition and in exercise. Students and staff, we're asking you to participate in the variety of activities that will be out there, because it is when people see others participating and having a good time doing the right thing that they too are encouraged to be a part of it. Of course, there will be walks and aerobics and yoga and a whole bunch of different activities that are being introduced in schools. And this year, as part of our conversations with our secondary schools, especially in the estimates, we have ensured that many of the schools are putting activities, sporting activities, including road tennis courts in the schools and other types of activities that make running around and just moving fun for our students. There will also be a syllabus that is related to healthy nutrition and activity that will be created for our early childhood and our infant cohorts, because the younger we get them, the better our chances of them carrying this through into adulthood. These activities and others focus not just on imparting knowledge and creating attitudes that are related to healthy eating and physical fitness. We believe that it will make for a much better community of people working together towards a common purpose at this time. As we are aware, the culture at each school is very different. Therefore, we have given schools the flexibility to craft their own approaches that will incorporate the action plan activities in their schools. Our team at the Ministry of Education, Technological and Vocational Training, we stand ready to offer the relevant support to all schools as needed. Students, we are encouraging you to hold yourself accountable and to hold your friends accountable to take responsibility for their own life and their own health. We are asking you to see the choices that are in your schools, and where those choices do not serve you, share that in a respectful way with those who are serving you, so that you help them to understand that you are in this with them. Adults, we want you to be aware that the behaviors that we are demonstrating today will be adopted by the younger generation. Children live what they learn. And we must create healthier habits, firstly, for our own well-being, and secondly, as a model for our children and for the generations to come. And as I conclude, I add my personal encouragement to all of our partners to let us continue working together for the benefit of our nation, starting with our children. Truth is, if we don't take care of our wellness now, then we will have to take care of our illness later. I thank you.
If we do not take care of our wellness now, we will have to take care of our illness later. Well, that later is now, because we spend a lot of money on preventable illnesses. That's just how we roll. We spend a lot of money now. So this policy is critical for the future of Barbados, really and truly. I can't stress how important it is. And we are taking the right steps in order to make our children healthier and to ensure a healthier, more productive future. A healthier, more productive future, and that's what we are all eager to achieve. At this time, we're going to hear from the Arthur Smith Primary School, where they will do their literary presentation. Arthur Smith Primary School, welcome.
Good morning, ladies and gentlemen. We will be singing the breadfruit song. B-R-E-A-D, bread is the thing that come from me. F-R-U-I-T, fruit is the thing that everybody eat. Bake it, fry it, roast it, and boil it. Put it all together and make a lot of tea. It will take 4 weeks to digest. This is the breadfruit run, the breadfruit time, the breadfruit line, the breadfruit all the time. First you pick it, second you peel it, third you boil it, or roast it. Maybe you pickle it, then eat it. We got the bread, we got the fruit, we got the bread, fruit. B-R-E-A-D, bread is the thing that come from me. F-R-U-I-T, fruit is the thing that everybody eat. Bake it, fry it, roast it, and boil it. Put it all together and make it out. It will take 4 weeks to digest. It will take 4 weeks to digest. It will take 4 weeks. It will take 4 weeks. It will take 4 weeks to digest.
The breadfruit song: bake it, boil it, roast it, and broil it. It will take the least to digest. Please give the Arthur Smith Primary School another round of applause. All right. At this time, I'd like to invite Dr. the Honorable Sonia Brown to give her remarks here.
Thank you, Master of Ceremonies. Before I begin with my acknowledgements, I want to first and foremost acknowledge the students who just came up here. I look forward to seeing your song in print, and I want to see a breadfruit song, a sweet potato song, a cassava song, and all the other fruits and vegetables which the rest of the world has acknowledged are healthier than what we import. But please permit me now to again acknowledge the following: the Honorable K. McConney, Minister of Education, Technological and Vocational Training; Permanent Secretary, Mrs. Betty Allen Headley, Ministry of Education, Technological and Vocational Training; Acting PS for the Ministry of Health and Wellness, Mrs. Gillian Applewhite; Chief Medical Officer, Dr. the Most Honorable Kenneth George, Deputy Chief Medical Officer, Dr. Anton Bess, Director of Planning, Mrs. Rashima. She's such a friend, I forgot the name. Cheltenham Niles. Chief Education Officer, Dr. Ramona Archer Bradshaw, Ministry of Education. Senior Medical Officer responsible for NCDs, Dr. Arthur Phillips. Dr. Ingrid Cumberbatch, also Senior Medical Officer. Mrs. Glensil Taylor, Nutrition Officer, Acton National Nutrition Center. Mr. Joel Emptishkiv, thank you for your remarks. Student rep from Harrison College. I need my glasses here. Professor Sir Trevor Hassel of the Healthy Caribbean Coalition. I also want to recognize Professor Anne St. John, all valued partners, students, members of the media, ladies and gentlemen. Good morning again to all of you. Today, it is my greatest pleasure to represent the Ministry of Health and Wellness at this highly anticipated launch of the Barbados School Nutrition Policy. Today brings to fruition this long-awaited step on the road to addressing the impact of non-communicable diseases on our Barbadian society. The school nutrition policy represents the initial component of perhaps a national nutrition policy, other components, including a national policy on nutrition in the elderly and other special populations, a national policy on food service management, and a national nutrition policy. The rising prevalence of being overweight or obese in our country's pediatric population has long been a significant concern of the Ministry of Health and recognizing that, and we have heard these numbers over and over again, and I again repeat, recognizing that over 30% of children in the 13 to 15 age group in Barbados are either overweight or obese, and obesity levels were at 16% in those at 10 years of age. Additionally, and perhaps even more sobering, at least to me, according to information in the 2020 Global Nutrition Report, Barbados still experiences an undernutrition burden among its under-5 population. Unfortunately, these patterns, when established in childhood, as Minister McConney alluded to, often progress into the adulthood, and this is demonstrated by our ever-increasing burden of non-communicable diseases in our adult population. Two risk factors are recognized as major contributors to the progression of overweight and obesity. These are: one, negative changes in dietary quality with the shift from traditional diets like breadfruit, of local, less processed foods, or I must note here, as I bear in mind the rising incidence of cancer, foods that were produced with little or no harmful pesticides and weedicides, to diets of highly or ultra-processed foods, which are high in salt, sugar, and fats, which require little to no preparation and are inexpensive and readily available. And two, a more sedentary lifestyle, as motorized travel became faster and hence more convenient in both our adult and pediatric populations, and cellular phones and other handheld devices replaced normal physical play and activity, save for perhaps exercise of one's thumbs, also in this case, both the adult and pediatric populations. Prevention of risky behaviors among children became, therefore, a priority in the effort to reduce the burden of NCDs. Within the school setting, many barriers exist. These include a lack of nutritional standards, unregulated marketing of nutrient-poor foods and beverages, and a lack of, or just not enough of, nutrition and physical education integrated into the school curricula. The Barbados School Nutrition Policy was conceptualized to address these deficits by providing an operational framework to guide school administrators in both public and private schools. Educational institutions are good vehicles through which to introduce obesity prevention interventions, as they offer continuous and intensive contact with children, as well as facilitate access to parents. The school nutrition policy will be implemented as a component of a suite of public health measures to address challenges related to poor dietary and physical activity patterns in children. Fiscal measures such as increased taxes on sugar-sweetened beverages and tobacco, reformulation of prepackaged products which are high in salt, sugar, and of course fat, front of package labeling, and a proposed ban on trans fatty acids all signal a move towards achieving health in a holistic way. The Ministry of Health and Wellness, through the National Nutrition Center and Health Promotion Unit, will not only provide technical support to the Ministry of Education, Technology, and Vocational Training and other entities, but also build key strategic partnerships and work collaboratively with stakeholders to develop implementation plans and offer guidance throughout the policy implementation process. A key partner includes the Barbados Childhood Obesity Coalition, a civil society grouping that advocates for policies and actions to effectively combat childhood obesity. The coalition contributed to the crafting of the policy, as we all heard, facilitated a pilot training program in preparing and offering nutrient-rich foods for canteen operators in both primary and secondary schools, and expressed willingness to support the implementation of the tenets of the policy. Other stakeholders in policy development included the Pan American Health Organization, the Barbados National Standards Institute, parent-teachers associations across the island, the Child Care Board, the Barbados Heart and Stroke Foundation Childhood Obesity Program, the University of the West Indies, the Healthy Caribbean Coalition, the United Nations International, UNICEF, United Nations International Children's Emergency Fund, still remember my schooling, the Food and Agricultural Organization, FAO. It is hoped that this policy is translated to the rest of the home environment, bearing in mind that school is but 6 days per week. For 6 days per week, for only 6 hours per day, 5 days per week, and roughly 39 weeks per year. I want to encourage parents and guardians to continue to encourage what is being done in our schools. Make it a part of an everyday lifestyle at home, not only for our children, but for ourselves. Continue to advocate for healthier foods within our school cafeterias and canteens, as well as healthier offerings by vendors and fast food establishments in close proximity to our schools. Share recipes in your WhatsApp groups and PTAs. Perhaps the school meals department can share recipes with parents for continuity in the home environment. Let's teach our children self-control, Joel, that it comes naturally. Stand up for appropriate sponsorship at school events, for instance. Every generation must be healthier than the one before. Our government is committed to addressing NCDs. The work on the school nutrition policy signals our continued commitment to protect our children by addressing risk factors affecting them, which will ultimately blunt the attack of NCDs on our population. We will continue to engage all sectors of the society to take responsibility and to provide environments that support healthier options for our children. Thank you so much.
Thank you, Dr. Sonia Brown. Every generation must be healthier than the one before. So we have to keep that in mind moving forward. Every generation must be healthier than the one before. So we're responsible for what happens for this up-and-coming generation. At this time, we're going to have our question and answer segment. So we're going to invite the ministers, permanent secretaries, and chiefs to be seated at the front of the auditorium so that they can field questions from the media. We have Glensil Taylor from the National Nutrition Center, Dr. Arthur Phillips, Medical Officer for the Ministry of Health. We have Dr. the Honorable Sonia Brown. We have Minister Kay McConney. We have Dr. Ramona Archer Bradshaw. And we have Mrs. Betty Allen. from the Ministry of Education. So we invite members of the media to come up and pose a question.
You said you would have met with the vendors, basically to ask them to follow the rules that you're putting forward. We just want to know what will happen if they sell what they're not supposed to be selling to the students.
Thank you very much for that question. And I must say that that's a question that is being asked quite a lot. The first thing we did was to sensitize the canteen concessionaires and vendors about the importance of creating healthy food environments. Based on the meeting that we had on Saturday, I must say that the interest in the creation of those types of environments was very high. Now, with regard to legislation, when it comes to the vending of beverages or food that are deemed to be unhealthy, there's no legislation in place. However, we are very well aware that the canteen concessionaires are on contract. So it would be in their best interest to serve meals, to sell beverages that conduce to the health of our young people. With regard to the vendors who are around the school, a similar thing applies. I'm very grateful to Francine Charles from the Heart and Stroke Foundation and to her team who have gifted us with a monitoring app. And this will allow us to go out there within the school environment and outside the school environment to see what is happening. And that monitoring app will allow us to take the actions that we have to take with regard to preventing vendors who are not supporting the mandate as given by the Ministry of Education. It gives us the ability to act on that. I hope that I've answered your question.
Good morning, everyone. My name is Trey Grace from the Newspaper. I had a few questions. The first one has to do, when does the policy officially take effect?
Yes, the policy takes effect in term 3, at the beginning of term 3. Yes, but as the minister said in her remarks, we have schools who have already begun some of the activities.
It was also mentioned that some of the schools already banned sweet drinks. Is there a case that certain fried foods or unhealthy foods will also be banned at schools as well?
Any foods that are deemed to be unhealthy, so for example, we are going to reduce the amount of fried foods sold at the school. So for example, we will have vendors or canteen concessionaires selling fried chips and fried chicken, lots of that every day. So we are encouraging them to use more baked goods. So we're going to encourage them to bake the chips, bake the chicken, use more salads with the meals that they're offering.
And then my final question, it was also mentioned that you plan to work more closely with parents. Then given that some parents may say buying healthier food is a bit more, it's not as economical for them, how do you go about advising them to, chart a better way for their students?
Between now and the beginning of term 3, we will have sessions for parents to show them the healthier alternatives. And they will learn during those sessions as well that healthier doesn't always mean more expensive. During the meeting with the canteen concessionaires last Saturday, one of the canteen concessionaires stood to talk about the offerings at their school or at the school to which they're assigned or where they vend. And they were able to show that they can offer things like breadfruit, the cassava, and the other types of food, what we call ground provisions, at an economical cost. So there is this false perception that healthy foods mean more expensive foods. That is not so. And as I said, we will have sessions with parents, sessions with other partners in education to educate persons relative to healthier alternatives.
Thank you.
Hi, good morning. Katrina King from the News. You speak about diversifying the menu for the kids, including vegetables. I was made aware of a case with regards to a school that was served school meals, and the entire week they were served carne beef. What will be done to, in the event that surplus of a particular product is going on for the high school police department or organization?
But I'm not sure if what you're saying is a fact, but as far as I am aware, the school news department they have a menu, and the menu indicates specific meals for specific days, and those meals are placed on the website, and the public is free to go on the ministry's website and see what menu will be served each day. It will not only indicate a rating, but you will have a picture so that there's an understanding as to what meals will be plated. So I'm not sure where you would have gotten your information from, but it does not sound like correct information to me.
And thank you very much for that. I think you know that the school meals department has just started. I shouldn't say just started, but we are now ramping up our efforts to be able to make school meals a lot healthier. And the permanent secretary just gave an example of what we did within the last 3 weeks only. As a directive, I had asked that every single menu from each center, because different centers serve different schools, so they cook for different schools. And some days they will get all the same things, some days they get different things depending on how we can source the ingredients, etc. And on our site, you should be able to go there now, you should be able to see that for each center, we have what the menu is supposed to be and also how it is supposed to be served. You may recall that a couple weeks ago, there was circulating on social media a picture of a meal that was incomplete. The rest of the story that was not told is that the child had said that they did not want some of the vegetables and other things that went on, and the server at the time thought of not wasting and therefore made the choice to go with the child's wishes. I've since had a conversation with Ms. Brown, who is the head of our school meals department right now, and they're in the process now of putting together a quality assurance program for how meals are to be served, and there will be the necessary training given for how you present meals and to ensure that if this is the way the meal is to be served today, then this is how we're going to ensure the quality of how it is served, and then what other strategies can be put in place to reduce wastage and encourage the child also to eat. So it is a combined approach that we have to take, because I want you to understand sometimes the way you see the meals is not necessarily the way it was meant to be served, and that's why we now have photographs on the website that parents and the public can go every day and see what is supposed to be served by which center. And we have the schools that are attached to those centers so that you also know which schools will get which meals and how they are meant to be served.
Good morning, Lurian Graham Prato, Stockholm News. Dr. Bradshaw, you said that there is no legislation in place right now to ensure that certain meals are being served to children. But there are also some vendors who are not under contract, who normally sell outside the schools in the morning, throughout the day, and in the evening. What action can or will be taken for those vendors who might be selling unhealthy snacks to our children?
At this point in time, we are using moral suasion. We are encouraging people to do the right thing because it's the right thing to do by the children. we are also providing them with alternatives so that they too can make a good living at the same time to do the right thing. So we are helping them to do the right thing, and we are also using moral suasion at this point in time. As you know, at different stages in the implementation of any policy, you can change the types of measures you will use to enforce and to encourage compliance. At this stage, we believe that we have seen the kind of support from the public and from the concessionaires and the vendors that we believe that with the right support and the right level of encouragement, we can help them to make that transition to the right thing. So we're not at the punitive stage at this stage in implementation. We are at the stage of moral suasion and encouraging people who want to do the right thing so to do.
There are no more questions or queries. Do I invite the panel to give any closing comments or any final comments if you choose to?
Thank you very much. I just wanted to say that the National Nutrition Center continues to be available with several nutrition professionals to provide guidance, to provide technical support for the various schools, the various institutions, and to support all of the initiatives towards educating the canteen operators and the vendors. I also want to make mention that you're going to be hearing more and seeing more resources available towards this effort as we progress towards the month of March, which is our nutrition month, and our theme is creating healthy food environments, and we're going to be definitely making a very special effort to make more resources and information available to the public. And as we progress throughout the year, we're also going to be embarking on our nutrition summer camp, so you just stay tuned. We are definitely going to be here to provide more information to support our Barbadian public in this area.
I really just want to say thank you to all of you who have contributed to the journey thus far. You heard the chair of the coalition say that this journey was years in the making, and we are finally here. I want to say one last thing, that the National Nutrition Center has been a tremendous partner to us as well. The next step in our relationship is to ensure that the meals, particularly those created by school meals, will eventually get to the point where we have the nutrition facts attached to the various meals and recipes. Right now we have ingredients, but we don't have the wherewithal to be able to put the specific nutrition facts because they have to be tested in a particular way and verified in a particular way. But it is our intention that with the right resources, we definitely have the will to go forward to give you even better information from a nutritional fact perspective. Thank you very much.
Thank you very much to the panel. We've almost come to the end of our session. We've heard a lot about the National School Nutrition Policy and the plans going forward and the efforts being made to phase out the unhealthy foods from the current school menu, school meals menu, and phase in all healthy foods at all times, even in times of emergencies when backup plans must be sought for whatever reason. At this time, I invite Assistant Nutrition Officer Mr. Brian Payne to do the vote of thanks.
Hi, good morning all. I think it was a very, very eventful morning. Again, with all protocols being established, it's my duty here today to kind of give a general thanks to all the persons involved in the school, in the development of the National School Nutrition Policy. So therefore, the honor is mine to express a heartfelt thank you to the persons from the Ministry of Health and Wellness, Ministry of Education, Technology, and Vocational Training, who contributed to the development of the Barbados School Nutrition Policy. Again, it was great appreciation that I especially commend the stakeholders. And these stakeholders would be the clinical nutrition services at the Queen Elizabeth Hospital, School Meals Department of the Ministry of Education, Technology, and Vocational Training, University of West Indies, Faculty of Medical Sciences, Heart and Stroke Foundation of Barbados, the Healthy Caribbean Coalition, and the Barbados National Standards Institute. And this is but a small representation of the wide cross-section of stakeholders who actually participated in the policy development process. So I want to thank those persons who were involved. Though much praise was given today and much discussion was had today, I think it's important that we not forget that the second and the third phases for the Barbados School Nutrition Policy have started. And this is where we actually implement the policy, monitor, and evaluate it. So, from my position in the National Nutrition Center and the wider Ministry of Health, I would ask for the continued support from the stakeholders, students, and also parents as well. Because again, the road is long and we hope to improve the school environment so that our children have a healthier, or have a better opportunity to live a healthier lifestyle. Thank you.
All right, thank you very much, Brian Payne, Assistant Nutrition Officer. I want to invite everyone to remain seated, and I want to invite the ministers, permanent secretaries, and the chiefs to do a special sampling of the products that we've brought today. Sampling of school and veggie choices, samplings from the school meals department.